Influenza virus. Influenza viruses are members of the family Orthomyxoviridae. The most outstanding characteristic of influenza viruses is their rapid evolution, which leads to its great variability. This is the case especially with influenza viruses. According to the antigenic properties of their envelope proteins, influenza viruses are subdivided into a number of subtypes. 16 different HA and 9 different NA subtypes have been identified so far. The nomenclature system follows the pattern H, X, N, Y, including the host of origin, geographical location, strain number, and year of isolation. Influenza B viruses are not further divided into subtypes. The accumulation of point mutations leads to a step-by-step modification of the virus proteins, above all in the two surface antigens HA and NA. This mechanism is described as antigen drift and is also typical of influenza B viruses. The variability of the type B viruses, however, is also characterized by other mechanisms such as insertion and deletion, as the influenza B lines show, which have been co-circulating and stable for more than 20 years. The process of antigen shift reassortment is defined as the exchange of whole genome segments, above all HA genes, which might result in influenza viruses which have a selective advantage compared with their parent viruses. A prerequisite for this reassortment is simultaneous infection of a cell by two different influenza viruses. This will result in a variety of different hybrid viruses with different characteristics which they have received from the parent viruses via the individual genome segments. An example is the occurrence of the influenza A H2N2 subtype in 1957, which superseded the influenza A H1N1 virus, which was dominant until then. Special attention was drawn to the public by the deaths caused in humans by the highly pathogenic avian influenza A H5N1 subtype. These cases have shown that an entirely new influenza virus can cause deadly infections in humans. Since the first outbreaks of H5N1-related avian influenza in poultry in Southeast Asia in 2003, human H5N1 transmissions with high mortality have occurred in 10 countries. It is possible that this virus will adapt better to humans and will then be able to spread among the human population. What is influenza virus caused by? The flu is caused by influenza viruses that infect the nose, throat, and lungs. These viruses spread when people with flu cough, sneeze or talk, sending droplets with the virus into the air and potentially into the mouths or noses of people who are nearby. Is influenza dangerous? Influenza A, aka the flu, can cause painful headaches, body aches and lack of energy, but for some, the virus can be more dangerous, even life-threatening. The flu and related complications claimed an estimated 80,000 lives during the 2017-2018 season, according to the Centers for Disease Control and Prevention (CDC). Influenza virus B. This genus has one species, influenza B virus. Influenza B almost exclusively infects humans and is less common than influenza A. The only other animals known to be susceptible to influenza B infection are the seal and the ferret. This type of influenza mutates at a rate 2 to 3 times slower than type A and consequently is less genetically diverse, with only one influenza B serotype. As a result of this lack of antigenic diversity, a degree of immunity to influenza B is usually acquired at an early age. However, influenza B mutates enough that lasting immunity is not possible. 61. This reduced rate of antigenic change, combined with its limited host range, inhibiting cross-species antigenic shift, ensures that pandemics of influenza B do not occur. Influenza virus C. This genus has one species, influenza C virus, which infects humans, dogs and pigs, sometimes causing both severe illness and local epidemics. However, influenza C is less common than the other types and usually only causes mild disease in children. Influenza virus D. This genus has only one species, influenza D virus, which infects pigs and cattle. The virus has the potential to infect humans, although no such cases have been observed yet. Symptoms of influenza: fever and chills, cough, nasal congestion, runny nose, sore throat, hoarseness, earache, muscle pains, fatigue, headache, irritated, watering eyes, reddened eyes, skin, especially face, mouth, throat and nose, petechial rash in children. Gastrointestinal symptoms such as vomiting, diarrhea, and abdominal pain may be severe in children with influenza B. It can be difficult to distinguish between the common cold and influenza in the early stages of these infections. Influenza symptoms are a mixture of symptoms of common cold and pneumonia, body ache, headache, and fatigue. Diarrhea is not usually a symptom of influenza in adults, although it has been seen in some human cases of the H5N1 bird flu, and can be a symptom in children. The symptoms most reliably seen in influenza are shown in the adjacent table. The specific combination of fever and cough has been found to be the best predictor. Diagnostic accuracy increases with a body temperature above 38 degrees Celsius (100.4 degrees Fahrenheit). Two decision analysis studies suggest that during local outbreaks of influenza, the prevalence will be over 70%. Even in the absence of a local outbreak, diagnosis may be justified in the elderly during the influenza season as long as the prevalence is over 15%. The United States Centers for Disease Control and Prevention (CDC) maintains an up-to-date summary of available laboratory tests. According to the CDC, rapid diagnostic tests have a sensitivity of 50 to 75% and specificity of 90 to 95% when compared with viral culture. Occasionally, influenza can cause severe illness, including primary viral pneumonia or secondary bacterial pneumonia. The obvious symptom is trouble breathing. In addition, if a child, or presumably an adult, seems to be getting better and then relapses with a high fever, that is a danger sign, since this relapse can be bacterial pneumonia. Sometimes, influenza may have abnormal presentations, like confusion in the elderly and a sepsis-like syndrome in the young. Emergency warning signs: shortness of breath, chest pain, dizziness, confusion, extreme vomiting. Flu symptoms that improve but then relapse with a high fever and severe cough can be bacterial pneumonia, cyanosis, high fever and a rash. Inability to drink fluids, signs of dehydration in infants, far fewer wet diapers than usual, cannot keep down fluids in infants, no tears when crying. Treatment: antivirals. The two classes of antiviral drugs used against influenza are neuraminidase inhibitors, oseltamivir, zanamivir, lananamivir and peramivir, and M2 protein inhibitors, atamantane derivatives. Neuraminidase inhibitors. Overall, the benefits of neuraminidase inhibitors in those who are otherwise healthy do not appear to be greater than the risks. There does not appear to be any benefit in those with other health problems. In those believed to have the flu, they decreased the length of time symptoms were present by slightly less than a day, but did not appear to affect the risk of complications such as needing hospitalization or pneumonia. Increasingly prevalent resistance to neuraminidase inhibitors has led to researchers to seek alternative antiviral drugs with different mechanisms of action. M2 inhibitors. The antiviral drugs amantadine and rimantadine inhibit a viral ion channel M2 protein, thus inhibiting replication of the influenza virus. These drugs are sometimes effective against influenza if given early in the infection, but are ineffective against influenza B viruses, which lack the M2 drug target. Measured resistance to amantadine and rimantadine in American isolates of H3N2 has increased to 91% in 2005. This high level of resistance may be due to the easy availability of amantadines as part of over-the-counter cold remedies in countries such as China and Russia, and their use to prevent outbreaks of influenza in farmed poultry. The CDC recommended against using M2 inhibitors during the 2005-06 influenza season due to high levels of drug resistance.